What's new in the news? New cancer drug could help cats and people. First clinical trial finds disease controlled in 1/3 of cats. Scientists at the University of California, San Francisco and the University of California, Davis have completed the first clinical trial of a new cancer drug in cats, offering hope for a disease that has long been nearly impossible to treat. The study found 35% of the cats with squamous cell carcinoma who received treatment had their disease controlled with minimal side effects. The drug will likely be effective for humans with head and neck squamous cell carcinoma. The study was published August 28th in a journal called Cancer Cell. Oral squamous cell carcinoma is one of the most aggressive cancers in cats. I lost my cat Mittens to this. He had one under his tongue. Most cats survive only 2 to 3 months after diagnosis, since surgery, chemotherapy, and radiation do little to stop it. We see these cats, we give the bad news, and we do our best to keep them comfortable until they're euthanized. So the fact that we have something exciting, anything that might help these cats, is very exciting. In the future, the drug will likely be used with other therapies, so this could be a great benefit. The drug, which was originally designed to treat human head and neck cancers, is the first of its kind to target a protein called STAT3. This protein acts like a faulty switch that tells cancer cells to keep growing. What's exciting is that this study shows it's possible to shut down a protein that drives cancer. That has been notoriously difficult in the past. The study also shows that pets with cancer can be good role models for human disease, and they may yield more reliable results than mouse models. The idea to test the drug in cats came from a discussion first author Jennifer Grandis with UC in San Francisco had with her sister, a veterinarian. She learned that oral cancers are extremely difficult to treat. So the UC San Francisco researchers coordinated with the veterinarians at UC Davis to recruit pets for the trial. One cat who benefited from the trial was a 9-year-old black short hair. The owner was devastated when they were told the cat had only 6 to 8 weeks to live. The cat received weekly treatments for a month, his symptoms improved, and he went on to live more than 8 months, long enough to spend another Christmas with his family. Other than mild anemia, none of the cats in the trial developed side effects that were attributable to the treatment. Of the 20 cats that were enrolled, 7 of them exhibited either a partial response or stable disease during the study period. Among the 7 that responded, the average survival post-treatment was 161 days, which is huge. Importantly, the treatment appeared to not only block the activity of STAT3, but also raise levels of a protein associated with an immune response to cancer. None of the cats in the trials were harmed, and many of them benefited. Researchers are currently working with a small biotech company to advance the new compound in clinical trials for both pets and humans. Very cool. So hopefully there's some hope for our cats in the future.